Hey, what's going on? Dr. Taylor, Aspire Chiropractic. Today I want to talk to you about something that kind of makes common sense, but kind of not if we don't talk about it very much. Cervical decompression, C-E-R-V-I-C-A-L, decompression. What is that? So anytime it seems that we see Facebook ads for decompression or ads on TV for decompression, or just anytime you see any kind of decompression stuff, I don't know if you notice it, but I sure do. It's always working on the people's low backs. Understandably so, sciatica is a real thing, okay? But a lot of people aren't aware that we also do cervical decompression. The cervical spine, basically, that means the neck. Now, if we do decompression on the low back to help with sciatica, what is sciatica of the neck? Don't Google that. That's not a real thing. But I'm looking for an analogy here. What is sciatica of the neck? Basically, during an exam, if somebody comes in and like they've got some kind of neck issue, hey, I've got a stiff neck, a tweak in my neck, I've got a stabbing thing here, I've got a headache. Those are all things that start to just get the clinical wheels turning like, hey, I wonder if they might need decompression. Because obviously the moment you start talking, I start thinking about the best way to help you. But if they say something along the lines of, I've got numbness and tingling in my hands and fingers, boom, there is like a 99% chance that you're going to be a candidate for decompression. So why would that be? Why would we do cervical decompression? Why would we stretch out the neck? So if we look at this thing here, this is your skull, right? Boom, smiley face. We've got 7 bones in our neck and 12 in our mid-back. 1, 2, 3, 4, 5, 6, 7, and then up to 12, okay? And between each and every one of those bones, we've got nerves coming out because we've got our brain up top here, and we've got our spinal cord going down like this, and coming off of that cord is every nerve in our body. Now, the nerves coming out from between the bones up in the neck, see 1, 2, 3, 4, go up into the head. We get down into C5, 6, 7, and T1. Those go down into the arms, hands, and fingers. So we come in, we do an exam, do a consultation, we ask questions, we do a physical exam, and like, hey, I've got some numbness and tingling in my hands. Pinky, ring, middle, pointer, thumb. Okay, where is the numbness and tingling? Oh, it's in my hand. Okay, so let's figure this out. Does this feel the same as this? Yes, it does. Does this feel the same as this? Does the pinky feel the same as the ring? It does. Does this side of the ring finger feel the same as this side of the ring finger? And then their jaw kind of drops because they're like, actually, oddly, no, it doesn't. My ring finger feels differently side to side. Or some people, does this feel the same as this? Does the ring feel like the middle? No, it doesn't. That's weird because I just thought it was my hand was numb. And now, doctor, because you're being so thorough and you're doing a great exam, I'm finding out that no, it's actually only half of my ring finger and all of my pinky, right? Or it's only my ring finger and my pinky, and it's actually not my middle finger, my pointer finger, and my thumb. Now, why do we do that? Reason being, nerves follow very specific paths. So for all intents and purposes, I've told this to people before, we've got our brain here, spinal cord, these nerves coming off of it. All I've done as a chiropractor in the most general of sense is I've just memorized a roadmap. I know what nerves go to your lungs. I know what nerves go to your kidneys. I know what nerves, come out here and go to your heart. I know which ones go up in here by your head and cause that pain right at the base of your skull. It feels like something's coming out of your eyeball. I've just memorized where these nerves go. So when we check your hand here, because you tell me you've got numbness in your hands, and then we determine that, it's really only numbness on the outside half of the pinky, or the outside half of the ring finger and the entire pinky finger, and then maybe a little bit along this side. You know what that does? That points me right to a very specific region of the neck, right there, right in the low neck, C6, C7, maybe T1, somewhere in there. Now, the reason being, when these nerves come out of the neck, they go in, around, over, and through each other, and they form something called the brachial plexus. So we've got individual nerves that come out like this, right? We'll take these 3. But then what do? Some of these nerves come down here and they join that one. And then some of these nerves go here and they join that one. And then, there's an X in here somewhere. Some join that one there, and some go up like that. So all of a sudden, this whole thing gets it's like the high five over there, right? Everything's twisting and turning all the way through. But again, no matter what kind of mess happens through here, they all end up at the same place, more or less. It might be the ring finger, it might be the middle. But based on the numbness and tingling here, we can tell what nerve's affected. So if we've got numbness and tingling here, that means we have a nerve issue. So what do? We trace back to the path of the nerve. We take an x-ray, and more often than not, what do we see? If we've got the cervical curve here like this, and we've got nice big spaces between the bones here until we get to the one right between C6 and C7, and all of a sudden that thing is all jacked up. Or even worse, if we've got something going on like this, where we've got those spaces here, and then all of a sudden we see a break in the curve like that. We've got this anterior olesthesis. We've got this bone sliding forward. Either way, whether it's choice A or choice B, it's putting pressure on the nerves that come out of there that go right into that ring finger, right where you said you had your numbness and tingling. How do we fix that? We address the joints themselves, move the bones back to where they belong, and making this thing put a nice little bow on it. We stretch out that neck through cervical decompression so we can address not only the joint issue, not only the bone issue, but the disc issue itself that's causing the pressure on the nerve that's causing that numbness and tingling in your hand. Whew! Every time we see decompression, it seems like it's lumbar spine. This here, don't Google this, is an example of sciatica of the neck. I'm going to title it that. It's not cervical decompression anymore. This is a video on sciatica of the neck. It's not a real thing, but it's got real symptoms. And cervical decompression, which we do here in the office, is how we fix it. That and the good old-fashioned, expertly delivered chiropractic adjustment. So if this sounds like something familiar to you, the numbness and tingling, not the sciatica of the neck, because again, for the third time, don't come at me. That's not a real thing. If this sounds something that is familiar to you or somebody you know that you think would benefit from this, by all means, just give us a buzz or walk right through that door. We're ready to help you when you're ready to be your best. Naturally, even if you're making up diagnosis.